Hey guys, welcome back to another video of respiratory system, and we'll be talking about the Gina guidelines 2023 in today's video. So what does this Gina actually stand for? This Gina here, it stands for Global Initiative for Asthma. It stands for Global Initiative for Asthma. Now, I had already discussed you briefly about everything you need to know for asthma. I've told you about the symptoms, the types of asthma, the pathophysiology, the diagnosis, and I have also spoken about the treatment, the drugs required for the treatment of asthma, and now we'll go for the GINA guidelines. So, before actually jumping into this chart, which is provided by ginaasthma.org, I'll just like you to know a little bit of basics over here. So let us start. So you already know that we had some particular drugs for the treatment of asthma. Now, if we talk about the drugs over here, we classify a different category over here and we name them as air drugs, which are nothing but anti-inflammatory reliever drugs. These are anti-inflammatory reliever drugs. And what sort of drugs do we actually use here? Here we have ICS plus rapid acting bronchodilators. So rapid acting bronchodilators plus ICS. So these two drugs which we call them combined as air drugs. So in the case of rapid acting bronchodilators, we have two options over here. We can either use formoterol or we can go for SABA. This formoterol over here, this is a rapid acting one. So we can have two options over here. We can either go with ICS plus formoterol, or we can go for ICS plus SABA. Okay, so this was all about our air drugs. And then we have another group here, which is our maintenance therapy. So in the case of maintenance therapy, we can have different type of drugs. We can have ICS. Here we can go for ICS, or we can have ICS plus LABA. We can have ICS, SABA, or we can have LAMA also. And then again, we have our leukotriene receptor antagonists. We have LTRA, and then we can have our biological therapy. So if you remember, I told you about a drug which was omalizumab, and it acts against IgE antibody. Now this omalizumab here, it comes under biological therapy. Now we have one more drug which is quite popular nowadays, and the name is Xolair. Now this is also a drug which comes under biological therapy, and it is basically used for allergic asthma. So this was all about our maintenance therapy, and then we have our controller therapy. So for what do we actually use the controller drugs? These controller drugs, they are used to they're used for the symptoms. They are used for the symptoms plus future risk. Then we have our relievers. Now what were the relievers used for? Like some example of the relievers we actually use are our SABA, short-acting beta agonists. Then we have our ICS formotherapy. Then we have our ICS and SABA. Now these relievers, for what do we actually use them? We use them as asthma inhalers. So these, they are basically needed for a quick relief. Now you can actually erase this ICS SABA from here because ICS SABA combo, we basically use them as relievers, not in the maintenance therapy. So you can delete this over here. So in the maintenance therapy, we have our ICS. We can use ICS alone, or we can go with ICS plus LABA, or we can go with LAMA drugs. Then we have leukotriene receptor antagonist drug, and we have biological therapy like omalizumab, Xolair. In the case of leukotriene receptor antagonist, you have montelukast, you have zafirlukast, and all sort of drugs. If you want to know about the drug used in asthma in details, I have already made a video on it, and I will put the video in the above I button so it will be easier for you to refer. So we have one more group of drugs here. We have our MART drugs. They're called as MART drugs and they stand for maintenance and reliever therapy. Maintenance and reliever therapy. So which drugs we actually consider in MART? We have ICS, our inhalational corticosteroids, and formoterol group. So this combination here is used in MART. So let me explain you a bit about the guidelines given. So first, they have said that you need to do three things over here. You need to assess, you need to adjust the treatment, and you need to review the response. So what does this assess mean over here? That is, you need to go for a perfect diagnosis of the condition basis on the symptoms. You should go for symptom control and the risk factors, including the lung function tests. You have to check the inhaler techniques and adherence and the patient's preference. Then you have to go with the adjustment. Here, you need to provide the asthma medications, no pharmacological strategies, and treat modifiable risk factors. And in the case of review, you need to review the symptoms, you need to check for exacerbations, you need to check for adverse effects, the satisfaction of the patient, and the lung function test also. So, this here was given by ginaasthma.org. So, these three things are to be done first. These three things are to be done first of all, and then we'll go with the main guidelines. So it is written over here that you need to first assess, you need to assess first, then you have to go with adjust, then you have to go with review. Now they have provided us two tracks. They have provided us two tracks. We have track one and we have track two. Now in track one, they have used ICS formoterol only. They have not used SABA. They have not used SABA. You can see over here that it is written using ICS formoterol as reliever reduces the risk of exacerbations compared with using a SABA reliever. Now, why have they used ICS formoterol instead of SABA? I'll tell you the points later on. Just for now, just remember that in track 1 therapy, they have used ICS formoterol instead of SABA. So, if we look for step 1 and step 2 over here, then we can use a low dose of ICS formoterol. We can go for a low dose of ICS formoterol as needed, ICS dose of formoterol. Now, how can you categorize a person with the step 1 or step 2? How can you start a treatment in a patient and you can give the treatment as step 1 and step 2 drugs? Then you have to see if the symptoms of the patient if they are less than 4 to 5 days a week. If the symptoms are less than 4 to 5 days a week, then you have to go for step one and step two. That is as needed low dose of ICS formoterol. Now, if we go on to step three, you have to give a low dose maintenance therapy. A low dose maintenance therapy of ICS plus formoterol. Now, how can we consider this step two? In which patients can we consider step three? If the symptoms occur most of the days, or if they occur with walking, if the person has an asthmatic episode while walking once a week or more, then we have to go for step three. That is, we have to go with low dose maintenance, that is ICS formula. Now, step four, if the patient has daily symptoms or the person is walking with asthma once a week or more and a low lung function, then you have to go with a medium dose of maintenance with ICS formula. And in step five, you can add a llama over here. So this was all about the track one. And one more thing, in the case of reliever, if you want to go with the reliever thing, then you can use as needed low dose of ICS formoterol again in track one. Now, if you go for track two, if you go for track two, then here they have said, here they have actually included SABA. Before considering a regimen with SABA reliever, check if the patient is likely to be adherent with daily controller therapy. Now, when do we actually go for the track 2 treatment? Only when the track 1 is not working for the patient, we go for the track 2 treatment. And here we consider SABA instead of ICS formoterol. So, here, how can we, in which patients do we actually use step 1? We use step 1 in patients who have symptoms less than twice a month. So here we take ICS whenever SABA is taken. So we take ICS and then we take SABA. And in track one, we were taking ICS with formoterol. Now in step two, in whom do we give step two? If the symptoms they occur twice a month or more but less than 4 to 5 days a week, then we go with step two. Here we have low dose maintenance ICS. In step three, whom do we give it for? We give for patients with symptoms most of the days or walking with asthma once a week or more. In step three, we again have low dose maintenance ICS LAMA. In step four, the patients who have symptoms daily or they are walking with asthma once or more times a week with low lung function. In these patients, we go with high dose maintenance therapy with ICS LAMA. And in step five patients, we add a LAMA. And for reliever thing, we give as needed short-acting beta agonists. That is SABA. I've told you the most commonly SABA we use is salbutamol. You can get all the details about the drugs in my previous video. Just go and watch. You will be able to understand this topic a bit better. So this was all about the Gina guidelines. So in track one for controller we had ICS formoterol, and for reliever as well we again had the same ICS formoterol. But in track two we had SABA, we had ICS plus SABA, and in the reliever we had short-acting beta agonist, we had SABA. So now why did we prefer ICS formoterol in track one than SABA? Now why was this preferred more? I'll tell you now. Why was ICS formoterol? Why was this preferred over SABA? Now, this was done because there was actually an evidence proving that this ICS SABA, that ICS SABA, it was comparatively limited. It had comparatively limited actions than ICS formoterol. This was limited. And one more thing over here was that there was a simplicity in track one. In track one, we had a simplicity. because we had to use the same drug for controller and for reliever as well. We had ICS formoterol for controller and ICS formoterol for reliever. So it was very simple for the patients and for the doctors as well to treat the patient. So it was comparatively easier for the patient. It was comparatively simple. So that is why we preferred ICS formoterol than SABA in track 1. So this was all about the Gina Guidelines 2023, and you can find actually all the details for asthma in my previous videos. If you have any doubt, just go and watch. And I'll be posting the other diseases in respiratory system as well. So just keep on watching and keep on learning. Thank you for watching this video. Thank you, sir.